Hi, I'm Dr. David Haase, and my goal is simple. I want you to have more good days. We're here together to discuss how we can make that happen. Today we're going to talk about neurotherapy and neurofeedback and the different types of those tools that we have available here at MaxWell Clinic. So I love this field because the brain is really at the center of really having great days. When your brain is working well, my gosh, so much of life can be dealt with and you can move forward and enjoy your time. When it's not working well, forget it. So the brain has to be prioritized in healthcare, and neurotherapy is an amazing tool. So first type of neurotherapy that we use is neurofeedback. Neurofeedback is simply learning. Think of this as physical therapy for the brain. Right? When you do physical therapy for, say, your knee, you are told by a therapist, move it this way, this many times, and this is the goal that we want to have. And you focus very carefully and do that. Your knee gets stronger, you get more function, and that's awesome. Well, your brain learns from feedback as well. Matter of fact, actually, your physical therapy on your knee is part brain therapy, but we won't get into that. So your brain waves can be trained. So this electrical organ up here has the ability to be able to learn and change over time. So we will use a quantitative EEG. This is a measurement of the electrical activity of the brain and the relationship of that electricity with each other. And we will compare that to an average database of healthy brains. And listening to you will help determine where exactly we should help your brain change to become more efficient so you can have the life that you'd like to experience. And that's pretty simple. We measure those brain waves, we program into our computer what we want to teach your brain, and we put the leads back on your head, and we watch the electricity come through the brain, or actually our computer does. And we're tracking over 16,000 separate metrics 4 times a second. And when your brain creates the electricity that goes along with better function towards a more capable experience in your life, maybe that's better attention, better mood, better memory. When your brain does what we want to reinforce, we give it a reward. And oftentimes that's watching a movie or listening to some sound. And when your brain waves drift away from what we want your brain to learn, the reward goes away. And the brain wants a reward, like the brain wants to watch the movie. So it figures out the 3-dimensional electrical combination lock to play to be able to make the movie play. And when it does that, because neurons that fire together wire together, amazing. Your brain actually gets better at making those brain waves, and then the function of those parts of the brain to start to become more efficient. That is neurofeedback. And what sets our neurofeedback apart is that we're training the whole brain all the time. Some places will put a little band on or put a couple of different leads on, and they'll basically train one thing up and one thing down. And sometimes you can really feel the difference of that. But it's not actually learning the complex relationships that need to be strengthened in order actually to improve function. So neurofeedback, and we can go into more depth of neurofeedback in some other videos, but that's one of our major tools. Another major tool is transcranial direct current stimulation. This is using very small amounts of electricity put at very specific sites on the scalp and putting through a small microcurrent. I like to say it's 1/9,000th of a 9-volt battery. That's how small this current is. But it's enough that it creates a kind of an easier way for certain brain waves to move. And when that brain wave has an ease going one direction, it's going to start going that direction more. So it can help with learning, attention, mood. It helps with cognitive processing, and even speeds the learning of motor skills in athletes or people playing the piano or individuals with Parkinson's. So it has many different uses, but that's using a low level of electricity to nudge the brain a certain direction. Another type of neurotherapy is what we call direct neurotherapy, and this is using very small, very low-level electrical signals that are metered to the brain exactly as you need them on a different type of feedback mechanism. This high-performance neurotherapy is great for helping break people out of cycles. We've seen great results for individuals that are stuck in a state of insomnia, anxiety, depression, that need a little nudge to get moving. But this form of neurofeedback doesn't teach the brain to have those beneficial changes long term, as well as the full cap neurotherapy does. Then we have using light to actually nudge the brain in the right direction. We have several devices that have a profound effect on cognitive function. One of those is called the Neuronic Helmet. And the Neuronic Helmet has the ability to shine very specific wavelengths of light in very specific pulsations at different points of the brain for very prescribed periods of time to nudge the brain one particular direction with regard to its function. So we can increase gamma wave activity, which is really important for memory and for learning. We can upregulate alpha or theta to help calm the brain and center the brain. And we can modulate exactly where that is. And we can use all of these tools together. And we often do. We stack them according to what are the needs of your particular brain and the challenges that you are encountering. So neurotherapy has many different tools available, and it's you really should not fall into the problem that you go to somewhere where all they have is a hammer, so you become their nail. And instead, you should really seek out somebody. We'd love for you to come here to MaxWell Clinic, and we'd love to be able to help you, that we could really understand the issue from a biological and an electrical cognitive function, and then design a therapeutic protocol, that would be right for your brain. I bet it's not colored quite like this, but I bet it's awesome. So again, this is Dr. David Haase at MaxWell Clinic, and we'd love to be of service. Take care.